Nevada's first choice for news. This is 8 News Now at 4.
Well, when you think of breast cancer, you likely think pink.
But it's not just women who are affected. In today's Buddy Check 8, the similar risk factors that can lead to breast cancer in men.
Well, it is Buddy Check 8 Day, when 8 News Now focuses on breast cancer awareness. And today we're focusing on a topic that's not covered very often. It's men who get breast cancer.
Does happen, though. Only about 1% of breast cancer cases in this country, with the average incidence among men just 1 in 1,000. But then you compare that to women, which is 1 in 8. 8 News Now anchor Paula Francis introduces us to a Las Vegas man who does have breast cancer and also his local doctor who's treating it.
Living with stage 4 breast cancer.
You can't help thinking about it often, but I try not to let it take over too much, and you try to enjoy things more.
As a man with breast cancer, Kevin is 1 in 1,000. But Dr. Brian Lawenda says treatment and risk factors are much the same.
We always typically think of the pink ribbon and women, but men can get breast cancer as well.
Family history and genetic predisposition are factors, but Dr. Lawenda emphasized the role of weight that is often overlooked.
The things that may increase the risk for developing breast cancer, whether it's a man or a woman, could be obesity. Alcohol is also a risk factor, and anybody who has a family history, that's particularly a close family history of breast cancer.
Kevin lost his mother to breast cancer, so there's a family history. And while he's slim now, he weighed 100 pounds more just 2.5 years ago. Today, healthy habits are helping him manage the cancer. He's had chemo and radiation administered in this linear accelerator. Dr. Lawenda showed us how it fine-tunes the radiation to hit just the tumor and spare the healthy tissue.
Precision is extremely important because we're trying to control for side effects.
It was different the first time, but going 38 times in a row, it's like what you do every day.
Being stage 4, Kevin's cancer is considered chronic, not curable. But new drugs and treatments will come that may prolong his life. And Kevin does a lot to help himself, like eating a plant-based, anti-inflammatory diet.
And I just try to do my best every day. And, I work a lot on, researching how I can at least make myself feel better, physically and, emotionally.
Stress reduction is important for him, and the physiology of reducing stress is anti-cancer in itself. Exercise is also anti-cancer in itself.
Paula Francis, 8 News Now.
Now, Dr. Lawenda, by the way, is one of the few radiation oncologists in the whole country who was also an integrative oncologist and a medical acupuncturist. So he does use several different methods besides the standard approach. For more information about breast cancer or Paula's Buddy Check 8 program or our sponsor, Susan G. Komen of Southern Nevada, just go to LasVegasNow.com. Very interesting.
How about that?
Yeah.